Everybody, my name is Karen Edison, and I'm the Senior Medical Director of the Missouri Telehealth Network and our Show Me Echo program here at the University of Missouri, and I'm delighted to give this talk for you guys today. We actually started back in the early 1990s here at the University of Missouri. The Missouri Telehealth Network started with some federal grants, and we started doing telemedicine. I was actually here back then and started out doing teledermatology. I'm a dermatologist by training. We developed a very robust telemedicine program here at the university, and at one point we were doing over 30 specialties every year using telemedicine, which we call telehealth now to be more inclusive. But really around the telehealth sphere, we're more of a resource center now, helping others get telehealth started and providing legislative and regulatory expertise to many of our partners. We are part of the Heartland Telehealth Resource Center together with Kansas and Oklahoma. Should mention that. And we do both telehealth and echo for all of these reasons, which you are all familiar with. We have a shortage of healthcare providers. We have a maldistribution of those providers. We have variable quality of care delivered out in some of our rural underserved areas. It saves lives, it prevents suffering. And also when you do telehealth or you do echo, you keep that healthcare dollar local. So if you prescribe a medicine or an image or a radiology test or a lab test, they get that done locally. And so that really helps that local community. I have done teledermatology for over 26 years. I had done mostly live interactive. I actually retired in May of 2019. I was chair of dermatology at the university for 16 years before I retired, and I did all kinds of telederm during those years. But in 2013, I met this man. I had an opportunity to meet Dr. Sanjeev Arora, who is a hepatologist and a visionary from the University of New Mexico in Albuquerque. And back then, like 20 years ago now almost, he recognized that people were dying all over New Mexico from untreated hepatitis C, from liver cancer and liver failure and things you get from having that for a long time. And he had like an 8 to 10 month wait to get in to see him at the university. And so he went around New Mexico and he said, who wants to treat hepatitis C? And about 30 healthcare providers raised their hand. And so now he has a Hep C echo clinic. I think he does his every week. We do most of ours twice a month. And I think his is 2 hours and most of ours are an hour. But he has an echo clinic where on his end is a multidisciplinary specialty team. So he has a pharmacist, a psychiatrist, a social worker, and a nurse. And the primary care participants call in using video conferencing. So they can use their iPads, their laptops, their iPhones. And I always say it depends on how old you are. It looks like Hollywood Squares or the Brady Bunch, or now everybody's used to the Zoom environment. So it's much easier to understand. So they call in, they get free continuing medical education and other education credits for doing so. And the way it runs is after your introductions, you really do a short didactic. Somebody on the Expert Hub team does a little lecture on something the participants really need to know. But you spend most of the time talking through the art and science of managing the patient cases that the participants have sent in ahead of time. And we do this based on what we've learned from our colleagues in education. And that is, as a physician, if I go to a CME program and I sit in the audience and I take detailed notes, we know from research that it's not likely to change my practice. But if you enter into an ongoing telementoring learning collaborative that is collegial, that is friendly, that is supportive, that actually changes practice. So we're creating these communities of learning where it's not just one-way delivery of information, where no question is a dumb question. We like to say it's an all teach, all learn kind of model. And this little picture shows when I did all that telemedicine all those years, I was taking care of one patient at a time. But when I led our dermatology echo for 5 years, I was teaching a whole group of primary care providers to take care of patients just like that. So it really multiplies your expert knowledge. It really magnifies what you can do. This is the model. So you have the expert hub team on one end, you have the spokes or the participants, and then behind the scenes, you have the operational team. And I'll talk more about that in a minute. So the participants send in the cases, we review them ahead of time. Somebody on the team does a little lecture, and then we ask the participants to present their own case. Now, sometimes that's a high bar, coming to a video conference and saying, this is my patient and this is what I did and I need help. So if you want to present that case and if you want to send it in anonymously and have somebody else present it, we have a methodology for that as well. But we talk through really the art and science of those cases, and it's a very rich conversation and people really learn from each other. All of these teams are multidisciplinary for sure. And then we make recommendations, and somebody records the hub team recommendations and they go back to the participant that sent in the case. There are 4 pillars of the ECHO model: using technology to leverage scarce resources, sharing best practices, using case-based learning, and then the O in ECHO stands for outcomes. So we really feel an obligation to do a robust evaluation and really do the research around what is the return on that investment and what are the outcomes from our programming. And I'll show you that in a minute. So what about Show Me ECHO? I was asked to talk a little bit about how we got it started here in Missouri and what it really took and what we attribute our success to. So here's where it started. In 2013, a staff of 7 of us from the Missouri Telehealth Network went to New Mexico with some other leaders from our state and learned about the model. We quickly understood how powerful this could be and how much we needed it in Missouri. So we came back, and in 1 year, we got $1.5 million out of our state assembly and our governor. But that year, the governor vetoed all new funding. So we dug deep and found some funding to start chronic pain and autism. In 2015, we actually got our money to get started. And then in 2016, we became a Superhub site, like San Antonio's becoming. We got some money from the federal government during the opioid crisis. They funded our opioid use disorder ECHO and our chronic pain ECHO. And then in 2018, we partnered with Missouri's managed care companies. And those companies practice in more than one state. So I'm not sure who all is in your region, but that would be something to look into. And we have a per member per month pass through those companies to help fund our Show Me ECHO programs. Since then, we have blossomed, and I think we have 35 programs now, and we have about 30 people on our staff. So it's gotten big quickly. How did we do this? Well, we started out by cultivating broad support. At the very beginning, when we got back from learning about ECHO, I invited everybody who's anybody to come to the University of Missouri. We're in Columbia, which is sort of in the middle part of the state. And I invited the leaders from all the health profession schools. I invited leaders from all the state agencies, Department of Health, Medicaid, mental health. I invited all the foundation leaders, all the major advocates, all the big associations related to health. I invited everybody who's anybody in healthcare to come and hear from Dr. Aurora. And he came here and lectured about the ECHO model. And then we went down to our state assembly. I'm in Columbia, and Jefferson City is about 35 miles south of us. That's where our state government is. And so we went down to the Capitol and we invited the leaders and the key members of the state assembly to a dinner meeting with Dr. Aurora. And then after that, we formed a team of 4 of us to really work the session. And Missouri's state assembly meets every year, and they meet from about January to May. So we really worked it. We had 2 people inside. One who had just been the head of the Health Policy Committee and was a physician, Dr. Wayne Cooper, who really brought the idea of ECHO to Missouri. And then Diane Franklin was a representative. And then on the outside, Rachel Mutro, who's the director of our program, and myself, we worked. So the 4 of us really worked it. We educated the governor's office, we educated the leaders in the House and the Senate, the leaders of the major health policy and healthcare committees and appropriations and budget, and also the key thought leaders in the state. And that was key. And then that first year, as I said, we got $1.5 million. And I've been around policy and politics a long time, and I've never seen anything go through that fast. I was a Robert Wood Johnson Health Policy Fellow in the 106th Congress. So in 1999, I went and worked for the U.S. Health, Education, Labor, and Pensions Committee in the U.S. Senate, and I stayed another year. So I worked in D.C. for 2 years on the Hill, and I've never seen anything go through that fast. And it's because it's such a great idea, and nobody was against it. What are the keys to our success? Really having those legislative champions in the assembly, engaging clinical champions early. We already had a relationship with our Missouri Medicaid program because of our Center for Health Policy that I was directing at the time. We get all of the Medicaid data, claims data from the state, and we're kind of a shadow data system for them and help them with a lot of issues. And so we already had this relationship with Missouri Medicaid. Also, our ECHO program is based at the Missouri Telehealth Network, which is a long-standing sort of trusted partner with the state and with lots of people around the state. And then we have sustainable funding through both an appropriation every year and then a per member per month pass-through through each of our 3 Medicaid managed care companies. And we include expert hub team members from all around the state, from other institutions and other locations, because Missouri, like Texas, has a diffuse power structure. While St. Louis may think they're in charge and Kansas City may think they're in charge, there's not just one place, right? So we find the best people for our expert hub teams wherever we can, and that helps our whole program. We also have an advisory council of key stakeholders that meets every 6 months, and we maintain a sense of transparency and accountability to them. And if an ECHO is not working or something's not going well, we stop it and reevaluate and sometimes reboot. And we've had to reboot 3 or 4 of our ECHOs. And so we try to always maintain high quality assurance and excellence in our programs. And I think that's one of the keys to our success. We also have had a big growth in our personnel required for it to operate smoothly. And you can see here the different kinds of people we have on our staff. But we cover marketing and communications. There's a lot of contracting when you're contracting with all these different hub team members from different institutions. We have a coordinator for every ECHO that we hold. We have our own IT professional. We have a robust evaluation team. And then key external partners, like our partnership with the Missouri Health Net Data Project and the Center for Health Policy. We look at that claims data to look where we need to do ECHOs, what we need to do ECHOs in, where there are gaps in healthcare, and where we need to go to recruit for different things. Our funding, like I said, is 3 main sources: state appropriations, managed Medicaid, and then also grants. Where does the funding go? It really goes into 3 buckets. One bucket is we pay parts of the expert hub team. We usually pay 10% for the lead and 5% for the hub team members. The second bucket is operations, and then the last bucket is our evaluation or outcomes bucket. How do we decide on new topics? There's really 3 ways. One way is we see a need in the data or from our health outcomes or our rankings. Another way is there's a funder who says, we want you to do this ECHO. So the Missouri Foundation for Health is a major health foundation in Missouri. And for example, they don't fund us that much, but they wanted us to do suicide prevention and foster care. And so we are. And then lastly, clinical champions who see a gap in care and take us an idea for an ECHO because they see that there's a real need. How do we build new ECHOs? We engage key stakeholders from around the state on that topic. We talk to everybody who feels invested and has a piece of that topic so that nobody feels like they're not included. We have a hub team recruiter, and that's all she does is she goes around and meets with everybody and asks, who are the best people in our state? And who's the best, where can we find the best for this? And where can we find the best for that? A lot of our ECHOs have pharmacists or nutritionists or psychiatrists or psychologists. I mean, there's a lot of different types of specialists that go into each of our hub teams. We keep the principles of health equity and diversity and quality and inclusion at the forefront. We try to build our hub teams to reflect the patients that the ECHO is trying to eventually serve. We want people from all of those different groups to kind of lend their voice to these discussions. And we want the best people. We want people who practice evidence-based medicine, who will share best practices, and who are mission-based to educate others and to share what they know. So we build these all-star hub teams, and we provide them education and training. When we build the hub teams, we have several virtual meetings before they go live, and it generally takes several months. So they meet and as a group talk about frequency and timing, what they're going to be called, who they're going to target. We train up all the hub team on the ECHO model, the overall goal. They establish a goal and usually 3 objectives. They establish their curriculum and who's going to give what little talk. And they establish what their outcomes evaluation plan is going to be. And before we ever go live, we do a mock ECHO to give them all practice in carrying it out with fidelity to the ECHO model. Here's a list of more than 50 organizations that we have more than 200 people from our expert hub team. So you can see we have people from Kansas City, from St. Louis, from Columbia, from Springfield, from all over the state on our expert hub teams. And here are our current Show Me ECHO topics. We have ECHOs in chronic diseases like diabetes and kidney disease and hepatitis C and hypertension and HIV. We have a lot of ECHOs around pediatrics, asthma, autism, child psychiatry, pediatric sleep. We have a lot in the mental health and behavioral health area, certified peer specialist, adult psychiatry, opioid use disorder, eating disorders, suicide prevention. We have a lot around pregnancy, high-risk pregnancy, Missouri moms and babies. We have moms, infants, and NAS, or neonatal abstinence syndrome, which are the babies born addicted to opioids. And we have several ECHOs with our education colleagues, Head Start, trauma-informed schools, and others. And we have quite a few ECHOs that are in planning right now. So you can see what those are here. We have a cancer care ECHO, public health nursing, interpartner violence, newborn medicine, dementia, Alzheimer's. So all of these ECHOs are in planning stages right now. And here's a map showing where our ECHO participants have come from around our state. We haven't hit every county yet, but almost. We have had 4 COVID-related ECHOs, 1 public health COVID-related ECHO, 1 COVID in kids, 1 for nursing homes, and then 1 for hospitals and critical care. And that's picked up a lot of people from around the state. And here's how we evaluate our ECHOs. We use what's called the Kirkpatrick model, where we start at the bottom with just participation, satisfaction. We go up to self-efficacy surveys. We go up to looking at claims and seeing how people practice, and then finally patient care outcomes, where we review the actual clinical records. A few important numbers, at least it's way over this now, but more than 100 melanomas that I know of have been diagnosed by our derm ECHO participants that say they wouldn't have if they hadn't been trained to screen for them. And we have hundreds and hundreds of people cured of Hep C that wouldn't have been without the Hep C ECHO. We have 1 nurse practitioner in a very, very underserved part of our state in the Ozark Mountains who's personally cured over 100 people with hepatitis C. So I'm very proud of her. And 100 families live within 45 miles of an autism diagnostician. So our Medicaid program has determined if you're a pediatrician and you jump through some other hoops and participate in ECHO autism, that you are worthy of making that early diagnosis. And then those kids have access to those specialized therapies that they need. And I just read an article this week, it makes a big difference if they get access to those specialized therapies early. And that's important because we only have 6 autism centers in our state, and most of them have a year wait to get in. So we're changing policy, we're saving money. We can see in our Medicaid data that our asthma ECHO participants, their patients go to the hospital less and end up in the emergency department less. So is it working? Yes. We're saving lives, we're saving money. All of our federally qualified health centers have somebody has participated in ECHO. We're doing not just healthcare, but education and veterinary medicine. We touched most of our counties, improving regulations, and you can see there we've had over 6,000 learners, and people have come from all over. It's virtual, and we're focused on Missouri because that's where our funding comes from, but people do come from all over, and 18 countries. And because we're a Superhub site, we're training other states and training other countries to do ECHO. So I'm going to stop there. This is our website, www.showmeecho.org, where you can go and scroll down, and on the right you can see all of our echoes, and if you click on one you can see who the hub team is and what the schedule is and what the curriculum is. And if you're interested in any of those topics, you're welcome to come. And then that's my email, edisonk@health.missouri.edu, if you have questions for me or if I can come and help in any way. We feel mission-based to share what we've done, the lessons we've learned, and we don't want other people to make the same mistakes we made, and we want other people to benefit for what's happened here. So with that, I think I'll end my remarks. I think these are recorded, but I think I'll be there with you when you actually hear this lecture, and I can answer your questions. Thank you very much for your attention.